The spread of false COVID-19 claims is going viral on TikTok, according to a new study. From more tongue-in-cheek references saying that, for example, pierogies help protect you from COVID-19.
Pierogies do not stop COVID.
To more impassioned claims based on erroneous data, false side effects, and death tolls due to the vaccine. The platform is swimming in vaccine fears. The research authored by Kieran O'Connor says in a study of 124 videos popularizing alarming and debunked stats on the COVID-19 vaccines, those videos have over 20 million unique views and over 1.6 million likes.
You can share the sound, the audio separately. And what's really crucial to this is that TikTok have shown signs that they are acting against these examples of misinformation, and removed the videos, removed the visual parts, almost think of it like the head of the snake, but the audio can still be shared. And that's what's kind of at the root of this.
That means while the videos may be taken down, the audio is still shareable as a soundtrack, furthering the opinions of users that the vaccines are harmful. At the time of this study, only 2 of the videos in the study featured a tag from TikTok pointing to resources that provide scientifically backed COVID-19 data.
People are completely entitled to have reservations, hesitancies about the vaccines, and they should also be entitled to get factual information on social media platforms, and that's where TikTok needs to come in and do more, frankly.
TikTok said in a statement, "We strive to promote an authentic TikTok experience by limiting the spread of misleading content, including audio, and providing authoritative information about COVID-19 and vaccines across our app. Misinformation is an industry-wide challenge, and we're grateful for reports that help us take actions on violations." So TikTok appears to be thankful for this new study. So after a request for comment from journalists, TikTok actually removed or limited the distribution of the videos and the audio shared in this report. But in using lemons to make lemonade, so to speak, there are a lot of healthcare professionals who are now using that audio that has claims that have not been verified or has already been debunked in a way to further the education of people for the COVID-19 vaccines. And they're debunking all of the claims they can. Nicole.